When reconditioning the abdominals after pregnancy, two key concepts must be understood and utilized. First, you need to learn how to control the shape of your abdominal wall during exercise. After pregnancy, the abdominals need to be trained to pull back in to the body during exercise. This is how to develop a flat abdominal wall. After pregnancy, it is all too easy for the abs to bulge out upon exertion. However, maintaining a flat abdominal profile during exercise is crucial. In fitness, what you practice is what you get. So, if you allow the abs to bulge out during exercise, that is what you are in effect training your abs to do. Expansion of the abdominal wall increases abdominal separation and contributes to many problems, such as lower back pain and pelvic instability, postural problems, uterine and bladder prolapse, as well as making your belly continue to stick out. Dynamic stability is the second key. Maintaining proper position during exercise is a critical component in the development of core strength and a well-functioning spine. After pregnancy, your joints are very loose and your abs are weak. So it is very easy for your pelvis, spine, or shoulders to be dragged out of proper positioning by the weight and the force of your limbs. Elimination of undesired movement of the pelvis, spine, and shoulder girdle during these exercises is essential. Both flat abdominals and core strength are developed by strengthening the innermost layer of your abdominal wall, your transverse abdominis. This is your internal girdle, and after childbirth, it needs to be reconditioned first. The transverse abdominis compresses the abdominal wall and draws the belly in. It acts like an internal splint, helping to close abdominal separation from the inside. It's the body's most important core stabilizer. Unlike most skeletal muscles, the transverse abdominis does not move bone. Before you begin this exercise program, it is important for you to be able to isolate and contract your transverse abdominis. To find your transverse abdominis, lie down on your side with your knees bent, hips stacked directly over each other, your spine long and neutral. You can relax your head in your arm or use a small pillow or folded towel to support your head. Relax your abdominal wall and allow it to fall onto the mat. Inhale normally and then exhale very slowly, hissing through your teeth. As you do this, draw your belly up and in as much as you can. Keep your torso completely still. Remember, the transverse abdominis does not move bone. Hold the contraction as deeply as you can for a few moments as you breathe naturally. If you find that you're holding your breath, it's because you are tightening and sucking up your diaphragm. If this happens to you, relax, start again, and try to isolate the contraction below your belly button. You can also use your hand to help pull your abdomen inward. Place your hand along the side of your body, close to your hip bone. As you exhale and hiss, tug a little bit with your fingertips. Use of the hand is not cheating. It helps you to learn the correct physical action and intensifies the contraction so that it is more effective. in the weeks after childbirth. Your muscles are lax and weak, and in the beginning, you might not be able to pull your belly in very far. But keep at it. As your muscle tissue gets shorter and stronger, you'll be able to pull it in more deeply and develop a more intense contractions. Transverse abdominis isolations can be practiced in bed before you fall asleep at night, or first thing in the morning when you wake up, or while you're nursing. A terrific place to isolate and strengthen the muscle is in your car. Cue yourself to pull your lower abdomen in and away from the lap portion of your seatbelt. The more transverse abdominis isolations you do, the faster your abs will flatten and the more effective this exercise program will be. Most of the exercises in this program include a contraction of the transverse abdominis. Another postpartum technique we'll be using in this program is belly scooping. This movement trains the abs to pull back in during exertion, shortens muscle tissue, and realigns the pelvis after childbirth. Lie down on your back in the neutral supine position. First, contract your transverse abdominis. Then, begin to turn your pelvis. As you do this, pull your abdominals down and in as much as you can to create this scooped out shape. Your entire lower back will be firmly pressed into the mat. Keep the rib cage relaxed. Take care that your sternum does not move downward. All of the work will be below your rib cage. Unlike other pelvic tilts you might have learned in the past, belly scooping is done with the muscles of the legs and the hips relaxed. Also, make sure that you do not lift your pelvis off the ground. To learn how to help yourself scoop out your abdominal wall, use your hands to help mold your belly inward as you turn your pelvis. Then, after you get that scooped out shape, try to tighten up your abdominal wall as much as you can. If your abs become hard and bulge out, relax your muscular effort and start again. If you have abdominal separation, 3 of the exercises in the second workout, Bounce Back Fast, will require you to splint your abdominal wall with the fit band. To splint your abs, lie down on your back with the fit band wide across the top half of your waist. Cross the band over your abdomen to form an X. Tighten up your transverse abdominis as much as you can. Gather up the excess band and pull tight, and wrap the band under your pelvis. Now pull the other side tight and tuck it underneath the other hip. The band should be fairly snug and form a wide X across your abdomen. To support your head during crunches and obliques, place your thumbs on your jawbones, the first 2 fingers on the top of your neck, and the 4th and 5th fingers on the base of your head. Your elbows will be about 8 inches off the mat, shoulders pressed firmly down the back. As you learn and practice these exercises, take the time to monitor your body positions and the shape of your abdominal wall. Work slowly and carefully in your body. If you find that you have trouble maintaining proper positioning during any of the exercises, decrease your range of motion and find in your body where you have functional control and start there. Then as you gain strength and skill, you can slowly increase your range of motion.